So either you're considering a prostate biopsy or you're signed up for one. This video is designed to help you understand the details of that procedure and work through that process. So currently, prostate biopsy is the only way to diagnose, work up, and manage prostate cancer. Biomarkers like a PSA can help us understand your risk of having prostate cancer, and MRIs are really good at localizing areas of the prostate that are more likely to have aggressive cancers, or help us understand your PSA density, basically the amount of PSA you're making per volume of prostate, which once again helps us understand your risk of having cancer. But the only way to really know if a man is harboring prostate cancer is through a needle biopsy. Now, prostate biopsies can be done in a variety of fashions. They can be done transrectally, they can be done transperineally, or through the skin underneath the scrotum. They can be done under local anesthesia, that's basically local numbing medicine, or they can be done under sedation. I've done them just about every way in my career currently, and my preference is to do all of the biopsies transperineally under sedation. I just think this is the easiest, kindest way to do the prostate, although we do have the ability to offer every form of prostate biopsy here at the University of Pennsylvania. So now that you've been decided to have a prostate biopsy, you're going to get a little bit of preparation. Most important things to consider: number one, you need to stop blood thinning medications. No matter how the biopsy is done, one of the biggest risks that we'll talk about later is bleeding into the urinary tract. So you want to be off things like aspirin. Motrin even can increase the likelihood of bleeding. Obviously, if you're on formal blood thinners for things like atrial fibrillation or blood clots, those will need to stop anywhere between 5 and 7 days before the procedure. We'll typically start them back up pretty quickly after the procedure, as long as your urine is clear. But they can dramatically increase the risk of bleeding and problematic bleeding after a prostate biopsy. In terms of preparation, you can pretty much eat or drink anything you want the day before surgery. We typically encourage soft foods or a liquid diet. It just helps empty out the bowels, particularly the colon and the rectum. We're going to ask you to do a Fleet's enema the morning before your biopsy. The reason we do that is not necessarily to clean out the stool and decrease bioburden or the risk of infection. That was true when we were doing transrectal biopsies. But when we put an ultrasound probe in the rectum to see the prostate, we want as much air out of the rectum as possible. So the enema is really to clear out as much air as possible and give us the best view of your prostate. That helps us target the areas we need to target and do the most informed biopsy. On the day of the procedure, you'll come in, you'll meet our nursing and anesthesia teams, you'll get an IV placed so that they can run in some fluids and the sedating medicines. You'll meet with me, we'll go over a consent form, and the consent form will be a shorter version of what this video talks about today. Once we bring you back to the operating room, it'll take about 20 minutes to do your procedure. You'll wake up in the recovery room. Should not be uncomfortable or minor discomfort. About 20 minutes later, you're awake enough, you're going to the bathroom. We're going to check to make sure that you can void or empty your bladder. And once your bladder is empty, you're on your way out the door. The biopsy itself, as I said, takes about 20 minutes. The first thing we'll do is put you to sleep. When you're asleep, we put your legs up in the air. This allows us access to both the rectum and the perineum. We'll place the ultrasound probe in your rectum so that I can see the prostate. I then put in lots of local numbing medicine, both at the skin and a little bit deeper at the front of the prostate to numb the nerves that are in that area. Then I'll perform your prostate biopsy. Every man at a minimum gets 6 areas sampled of the prostate. These are the 6 most common areas that prostate cancer is likely to be. It's called the peripheral zone of the prostate. And we do both the right and left side, in the posterior, medial, and what we call anterior sides of the prostate. For men on active surveillance, we'll also sample at least once in your life the transition zone. That's the central area of the prostate, mostly where BPH lives, but rarely can harbor cancers, particularly in men with active surveillance. And if your MRI showed any suspicious areas, we'll specifically target those areas. If there's 1 area on your MRI, that means you get 1 additional biopsy. If there's 2, you'll get 2 areas sampled. Every area we sample gets at least 2 needles. So if you're just a man with an elevated PSA and no MRI abnormalities, you're going to get 6 areas times 2, that would be 12 needles. If you're a man on active surveillance, 6 areas, 1 transition zone, plus you've got an MRI target, that's 8 areas, 16 total needles to make sure we're accurately sampling the prostate. Once we do your prostate biopsy, we wake you up, bring you over to the recovery room. What you can expect in the recovery room is feeling a little out of it. Those medications will wear off. You'll be a little drowsy, a little out of it. But as you come to, you may have the sensation that you have to urinate. That's a good sensation. We've been giving you fluids and we want you to pee before you leave. Things to expect: we expect to see blood in the urine. In fact, blood in the urine we expect for at least 24 hours, and it can last as long as a week in some men. Things that are notable that I want to know as a urologist and my team wants to know about: if you're bearing down to push out big clots, or if you can't pee, we need to know about that. There's things we can do to potentially help you, but you may even need to come into our office if it's during hours, or your local emergency room if it's after hours, to help with urinary retention or a problem with bleeding. We also expect blood in the ejaculate. That can last for 6 to 8 weeks. It's not dangerous, it's not painful, it's not going to harm you or your partners, but it's weird. And that color will change. At first, it will be red as there's fresh blood in your prostate. But as that blood dissolves, over time, it will become brown and potentially even purplish as that hemoglobin and iron is broken down in the prostate. Infection is an incredibly rare complication of prostate biopsy now. In fact, it's less than 1%, whether that biopsy is done transrectally or transperineally. The difference is with a transrectal biopsy, you have to get antibiotics, and those antibiotics should be directed towards the bacteria that are commonly found in the rectum, potentially even specific bacteria for your rectum. With a transperineal biopsy, you don't need any antibiotics because we're not going through the rectum where there's a high bacterial count. Instead, we're going through skin, and we can sterilize or prep that skin to make sure there's minimal risk of infection. There are some special circumstances where we will recommend or you will ask for antibiotics, and we're happy to talk about those. The other question that commonly comes up with prostate biopsy is: when can I return to normal activities? And the basic answer is as soon as you feel up to it. We ask you to refrain from strenuous or moderately strenuous activities on the day of surgery, mostly because you had anesthesia. We just don't want you to get hurt if you're disoriented or things aren't just quite feeling right. But the day after surgery, if you feel up to it, you can resume any activity you see fit. Our cyclists ask a lot: yes, you can get on a bike. It may not be the most comfortable thing because that area underneath your scrotum can still be a little tender. We've passed at least 12 needles into it. That tenderness and inflammation typically pass within 48 to 72 hours. Most men are taking just Tylenol or Motrin for pain. We do not routinely prescribe narcotic pain medications, and will typically dissuade most patients from narcotics unless there's a real reason to consider that. So I hope you find this video informative. Look forward to doing your prostate biopsy and speaking about the results.